Welcome to Adapting Class video number 3 for our pharmacology test series. We're going to talk about endocrine meds. These are medication that shows up on your NCLEX. Let's use 15 questions to analyze them. Thank you for your comment and thank you for your like and supporting the channel. These are the medications we'll be talking about. You can see it's very extensive, but those are the one NCLEX will ask you. There's few things you need to know about them. These questions and answers on pharmacology will take care of it with this endocrine stuff. First question, don't run away from it. I know you know it, but when you see it presented in a different way, you get discouraged. Don't do that. Let's stick with it. And next reviews insulin order. Glargine, 20 units, subcutaneous daily at 8 a.m., right? Lispro, 6 units, subcutaneous with meal, right? And patient lunch will arrive, what, 12:30 p.m. When should the Lispro be given? You give it to the patient 1 hour before, that means what? 11:30 a.m. or 30 minutes before 12 p.m. or right before eating or 30 minutes after they eat. You know the concept. Bring it there. Lispro, what is the medication? It's a rapid acting. What is the definition of rapid acting? This should be given before meal. Therefore, what answer choice you should pick? Give it before meal. So right before meal. That is all. Number 3 is the right answer. If you give them 30 minutes before or an hour before, they're going to have hypoglycemia. If you give them after 2, hypoglycemia. Therefore, 3 is the best answer, right before eating. You see how you take the concept and use it to answer the question. So Lispro, know about it. Glargine is a long-acting. Next one, and let's prepare to administer regular insulin IV to a client with what? DKA. Which action is most important? The buzzword is which action is most important? Administer the medication, what? With meal, hold it if potassium is less than 3.5, shake the insulin vial before drawing, give subcutaneously in the abdomen. Stop the video, put down your answer choice, and then listen to the way I approach it. If I'm answering this question, keywords. Look at the question, regular insulin, and there's IV there, intravenous, and this patient has what? DKA, and no patient is sick. A DKA patient should be NPO, should be probably in the ICU, will be giving IV insulin. Therefore, number 4 is completely wrong. The question stem said IV insulin. Why would you choose number 4? It says subcutaneous. No, we said we're going to give it to them IV. Shaking the vial before using it is not the appropriate way of administering insulin. This is going to be a drip of insulin. Hold if potassium is less than 3.5. Potassium will be driven into the cell with insulin. Insulin is one of the most common causes of hypokalemia in the patient who has diabetes or DKA. Therefore, we got to make sure we hold the insulin when potassium is low. Patient is going to be NPO because they have DKA. So administer with meal is not right because the patient will be having what? IV drip of insulin going on. Therefore, the right answer is number 2. Next question. And let's provide teaching to a client with what? New prescription for metformin. Which instruction is most important to give a client? The keyword how to answer the question, I try to make the question short, but yes, everything you need to know. You're providing what? Teaching, that's the buzzword. The second buzzword is what? A new prescription. The third one is what? Metformin. And the most important is the most important. This guy is the most important that you got to give to the patient, right? Therefore, what do you know about metformin? It's one of those medications that used for diabetes. It's oral diabetic medication. It does not stimulate insulin production. Therefore, number 4, we say monitor for weight gain is wrong. It does not stimulate insulin production. Anything that stimulates insulin production will cause weight gain. Avoid alcohol and contrast. Think about it. Expect occasional low blood glucose. Since it does not stimulate insulin, there is not going to be hypoglycemia. 2 and 4 is a concept answer choice. Take with meal to avoid GI upset. Yes, it causes GI upset, but which one is the most important? Prioritization 101. Contrast diet and alcohol will make you have what? Lactic acidosis. That is the problem. You see how this question testing your content level in terms of how to analyze prioritization. So number 3 is the right answer. Next one. And next monitors a client on prednisone for which complication? Select that apply. Think about it. What does prednisone do? It's one of those medications. If you don't even want to analyze it, think about a Cushing patient. How should a Cushing patient look? Change this question into a Cushing patient. A Cushing patient has too much steroid, and therefore their blood pressure is going to be high. If your blood pressure is high, you have hypertension and hypernatremia. If your sodium is high, your potassium is going to go down. You see how I'm breaking down. What does steroid do? You hold on to things. So you hold on to water and it increases what? Your sugar. So hyperglycemia. There's a risk of infection. You see, everything is connected. And then break down your bone. Your skin becomes very thin. You bleed easily. I've given you all the signs and symptoms of what? Steroid related to adrenal dysfunction. Therefore, what? Number 1, hyperglycemia. He said it's a complication of what? Prednisone, which is the steroid. Infection risk is going to be high. Your skin is going to break easily. Your sodium is going to be high, and you're going to have osteoporosis. It's a selected apply. You don't have to pick everything. Pick those that you're confident. Therefore, 1, 2, 3, and 5 are your right answer. This you got to know regarding steroid. The next one, a client is taking levothyroxine, report weight loss, insomnia, palpitation. Which instruction is most important to give it to the client? Reassure the client, tell them to stop taking the medication, notify the healthcare provider, and suggest taking it at bedtime. Think about it. I see levothyroxine and say, oh, this is thyroid hormone. Why do I give it to you when you have low thyroid hormone, hypothyroid? What does thyroid hormone does? Increases everything except your weight, right? So if I give you too much thyroid hormone, your heart rate goes up, right? You can't sleep. You become restless. Your blood pressure goes up. Thus, your metabolism increases. This is the signs of what? Hyperthyroidism. It's the same thing as me giving you thyroxine. So if I give you thyroxine, you're going to look like hyperthyroidism. Patient symptoms is consistent with what? Hyperthyroidism. That means the patient is having what? Side effect. What do you do? What do you do? Think about it. I want you to put the answer for number 5. What do you do in this situation? Patient is getting levothyroxine and he's looking like he's having hyperthyroid symptoms. You don't reassure them. You don't tell them to stop it. It's a steroid. They get a rebound. You tell the doctor and you can make some adjustments. They can't take it at bedtime because this medication has to be taken in the morning. Number 3, right answer. And this is assessing the client taking what? PTU, propylthyrouracil, for hyperthyroidism, which finding require a priority action for the client. I always say, how do you answer question? Read it from the back. What is the keyword? Require priority action. You're going to circle that one. Then you go to the stem of the question. And next is assessing a client taking what? PTU. That is your prioritization medication. That is your buzzword. Therefore, rewrite the question. I have PTU. What should I worry about? If you don't know anything about that medication, PTU, put the thyroid hormone under. Secondly, think about it. It suppresses thyroid function. Therefore, it makes you hypothyroid. Is that the priority? No. Fatigue and cold intolerance. Altered test. yellow urine, and a sore throat. There's two things you have to know about PTO. It causes agranulocytosis, it affects your liver, and it has other common side effects. Once again, it causes what? Agranulocytosis, it affects your liver, and it has other common side effects. Fatigue and cold intolerance is what? It's because it suppresses your thyroid hormone, and therefore you're looking like hypothyroid. I'm worried that, let's see, we're talking about prioritization. Auto test is common. One of them, but yellow urine may be related to what? Your liver function. And then sore throat is what? Infection. Which one is most dangerous? Agranulocytosis, which is sore throat, yellow urine related to liver function, or test, which is the normal function, and number one, which is hypothyroid symptoms. Think about it. Agranulocytosis is more deadly. Therefore, we should pick number 4. This is a hard one. I designed the test this way so that I take you up and down. It's a simple prioritization question, and you have to prioritize agranulocytosis over liver dysfunction. And next, provide teaching to a client receiving what? Radioactive iodine therapy, which statement by the client indicate effective understanding of the teaching. The buzzword is radioactive iodine therapy. This is used to destroy your thyroid hormone if you have hyperthyroid and you can't take medication. I will isolate my laundry and utensils. Is it a good thing? I will take it with food. Is it a good thing? I can be around children. I will expect my hair to fall out. Think about it. You have hyperthyroid. I'm giving radioactive iodine therapy. Even if you don't know what it is, the word radioactive tells you something that can spread, right? You can emit radiation everywhere. Therefore, you should isolate yourself, which answer choice indicate isolation. I'm trying to break down the question one by one, right? So effective means isolating yourself because it's radioactive. You take it with food. No, this is given once. It's a trap. You get the radiation once, you get in your system, and you're doing things until 5 to 6 weeks, and you get out of your system, right? So 2 is irrelevant. You cannot be around children because what? It's going to, you can expose them. And you don't expect your hair to go out. The dose that they give you is not like true chemotherapy stuff. This is just ablation of your thyroid. I will isolate my laundries and utensils because all your body fluids will contain radioactive substance. Number 1 is your right answer. And don't forget this answer. How many answers have you had so far? We are on number 7, halfway. What do you think? What is the tally? Put it in the comment section. And then she's caring for a client newly diagnosed with what? Hypothyroid, who is prescribed what? Levothyroxine. We've seen this already. That means they have hypothyroid, they need thyroid hormone. We're giving them steroids. Which statement by the client indicate a need for further teaching. They're saying something that is wrong. How do you answer questions? Rewrite the questions on your own and use the buzzword. That means I have hypothyroid, I'm on levothyroxine, and I need some teaching. Therefore, these 3 words I'm focused on. I'm saying something bad about what? Levothyroxine. What do you think? I will take this pill first thing in the morning. Is that what you're supposed to do? I can expect to feel more energetic within a few days. What do you think? I will report chest pain or a rapid heartbeat. Is it a bad thing to do? I will have my thyroid level checked regularly. Hey, what do you think? I will remain upright for at least 30 minutes after taking the medication. Is it necessary? Stop the video, put the answer choice down, and let me know. But this is the concept I'm giving you because this is pharmacology test. I got to give you all the content related to this medication because this is high yield medication. Your board will ask you. Levothyroxine should be taken early in the morning, empty stomach. No antacid, no milk, nothing like that. I will expect to feel more energetic within a few days. It's a steroid. It takes some time to work. I will report chest pain or rapid heartbeat. I'm giving thyroid hormone that speed things up. Therefore, that is expected. I will have my thyroid level checked regularly. Yes, you have hypothyroid. I want to make sure the medication is working. I will remain upright for at least 30 minutes after taking the medication. It causes esophagitis. In order to prevent irritation of the esophagus, remain upright. Which one need further teaching? There's only one answer choice. Taking it in the morning is good. You're not going to feel well right away. You should report chest pain. You should have thyroid hormone check, and you should remain upright. Number 9, NS is providing medication instruction with the client prescribed PTU. We are now in the hardest portion of the test where this requires select or apply thinking. But you don't have to pick everything. If you know only one answer, pick it. Don't over-select. Which statement indicate a need for further teaching? Select or apply. What is PTU? We talk about it. Put the thyroid hormone down, right? And this is what is the problem. Major problem, agranulocytosis, followed by what? Liver dysfunction, followed by changing your taste and then your GI. Therefore, which one need further teaching? I will take this medication for 3 months. No, you take it continuously. I will avoid crowded place while taking this drug. Yes, because you're going to have agranulocytosis. I can expect my heart rate to increase. You put the thyroid hormone down, therefore the thyroid hormone will slow down your heart. That's not true. Routine liver tests may be needed during treatment because your liver function will be affected and may bruise more easily while on this medication. This is the hard one. Any medication that causes agranulocytosis can also cause you low platelets and anemia, because how does they cause agranulocytosis? They go to the bone marrow and it suppresses your bone marrow. So they basically actually refer to as pancytopenia, decreasing your red cells, the blood cells, and the platelets. So these are the things you're supposed to pay attention to. White cells, red cells, and platelets go down and become pancytopenia. Therefore, 5 is a good thing. So which one need further teaching? Number 1, will you take it forever? For a long time. It does not increase your heart rate, it decreases. So 1 and 3 is your right answer. And then she's teaching a client taking methimazole for hyperthyroidism. This is the second medication that you can use for hyperthyroidism instead of PTU, which instruction is most important to include. Avoid seaweed and dairy products. Notify the provider if you develop a sore throat. You may feel jittery for the first few days. Take this medication with food. There's a content there. In that statements, look at it. If you don't know anything about methimazole, I'm giving you one thing and one thing only. It also causes agranulocytosis. So pay attention to that. Therefore, based on that, what do you think? Avoid seaweed and dairy products. The seaweed has a lot of iodine, and that can also affect your thyroid function. It's very important, but it's not that important in this situation. Notify the provider if you develop a sore throat, agranulocytosis. You may feel jittery for the first few days. Think about that. This is a good one. Think about it. Jittery means your heart is going to have palpitation. PTU is putting the thyroid hormone down. How can he increases your heart rate? If he's increasing your heart rate or you're having palpitation, that means it's not working. That is number 3 is telling you. The medication is not working. That means you're not having side effect of the medication. We should increase the dose. Take this medication with food, not necessarily. Agranulocytosis is dangerous, it's sepsis. Therefore, 2 is the right answer. And then scales for a client on what? Desmopressin. Which lab results is a concern? Desmopressin is ADH. What does ADH do? They hold on to water. So the desmopressin will hold on to your water absorption. What does water do? It causes dilution and give you dilutional hyponatremia. With antioxidants indicate dilutional hyponatremia. Number 3, this is a straightforward content. Next one, a client on long-term steroid suddenly stopped the medication. Think about it. I stop the medication I'm taking, the steroid. Which complication is most concerning or you should be concerned about? What do you think? Thyroid hormones, especially which is a steroid, corticosteroid, which is a steroid. What do you think? Steroid hormones, what do they do? We talk about it. We saw a question like that. They increases your glucose. They increases your sodium. They decreases your potassium. They increases your blood pressure. These 4 things is good to know. But patients stop taking the medication. What do you think? Should their sugar goes up? Should their blood pressure goes up? Should they have fatigue? Or should they have fluid overloaded? This is interconnected. Let me give you the pathophysiology. You take your steroid, it helps with your sodium, you hold on to your water, your blood pressure goes up. It increases your glucose, right? What do you think? Fluid overloaded is when you have steroid. I don't have steroid anymore. Hypertension is when I have steroid. I don't have it anymore. Hyperglycemia is when I have steroid. I don't have it anymore. When you stop your steroid, you're going to have adrenal crisis. Adrenal crisis present like profound fatigue. 3 is your right answer. A nurse is teaching a client with newly prescribed glargine insulin. Which statement by the client shows what? Correct understanding. This is very, very important. There's a concept there. I will mix this with the regular insulin in 1 syringe. I will take this before each meal. Endocrine medications are very important. NCLEX love them because we see them all the time. A lot of people are on diabetes. I will take these once a day, same time. This works quickly, so I will hit right away. These statements are saying things that you already know. But I've changed it. I don't use the word that is supposed to be used, like fast acting, rapid acting, long acting. Those statements is what they mean that I put it in this form. So NCLEX will do that to you. One thing about glargine you should not forget is a long acting. You never mix it with anybody, right? It has no peak, and you take it once a day. Therefore, number 1, I see mixed, I take it away, right? It's a long acting. You don't need to take it with meal. You take it once a day. It's daily, and it does not work quickly. That's why you take it once a day. Therefore, 3 is the right answer. And then as received money report on multiple clients, which finding will cause the nurse to hold metformin? Rewrite the question again. What are the contraindications for metformin? That's all. Which situation you should not give a patient metformin? Patient is having cardiac catheterization. Patient blood glucose is 110. Patient has mild nausea after meal. Patient hemoglobin A1C is 8. You can see. Stop the video and the answer choice is popping out like a candy. It's right in front of you. Using the buzzword, you can see it's popping out. Metformin, contraindication. What do I know about metformin? It causes nausea, right? Number 3 is not a problem. Why am I using metformin? Because you have diabetes, hemoglobin A1C of 8. I'm not going to stop it. I'll give it to you. No, 2, sugar is fine, but it's not the priority compared to 1. 1 means contrast, and contrast allergy should avoid metformin because it causes lactic acidosis. And let's review the med list of a client. Last question. With the patient with Graves' disease, which prescribed medication require clarification. This summarizes everything we talk about using concept to answer the question. Underline the buzzword. The buzzword is grave disease. Which medication I should clarify? Then if I'm the best way to answer the question is say grave disease. What medication do I need? That medication should slow down the thyroid hormone, right? That's all. Anything I'm going to give you for grave disease, slow down the thyroid hormone and the effect of the thyroid hormone. The effect of the thyroid hormone is tachycardia and anxiety. Whoa, I see propranolol. Good. Iodine solution is going to destroy the thyroid. Methimazole is going to put the thyroid hormone down. Levothyroxine is the thyroid. I cannot give you any more thyroid. Easy way to confuse you, but that is it. Take care of yourself. Number 4 is the right answer. Thank you for watching. Thank you for following the series, and thank you for your comments. Take care of yourself, and good luck.